Hi, Mike Woodworth with Makari Wellness. Brief video on acupuncture ophthalmology. By far one of the more challenging aspects of our clinic, and not because the treatment is difficult. The treatments are amazing and they work. But the challenging part is that most of the people seeking treatment for these conditions were told that there's nothing they can do. The caveat to that statement would be there's nothing we can do in Western medicine because we're trying to treat the disease. Addendum. Chinese medicine is executed in a fashion that treats the person, the individual, and their internal imbalances that often allow for disease progression. So acupuncture ophthalmology is scoffed at, namely because it is a specialty, and a lot of acupuncturists in the general practitioner, they're not going to get results. I know, I was there once. Since then, I've had personal experiences where I put my time and energy into training. And I've been trained by the #1 guy in the world for acupuncture ophthalmology. And he's our mentor, and we train with him to this day. And we've seen amazing results. So we do treat all these neurodegenerative conditions, and we can treat effectively. Now, is everyone going to be miraculously healed? No, that's unrealistic. That's unrealistic in any regards, because what it takes into account is how vital your energy is in terms of your age, how good your life is, how healthy you are in your constitution, and then your lifestyle. And to make changes in these conditions, whether we roll back your eyesight to what it was 2 or 3 years ago or more, sometimes it happens more, or we simply slow the progression, or we actually stop and sometimes reverse that progression where people, even after years of treatment, are still getting improvements, okay? That all is determined on the individual, your treatment, and then your lifestyle advice, which is very important to change your lifestyle, okay? But it is effective, and we do effectively treat a lot of these conditions. Macular degeneration, wet, dry, retinitis pigmentosa, Stargardt, glaucoma, cataracts. Cataracts, we're not going to reverse your cataracts, but we can slow or stop the progression. But if they're advanced, you're going to need surgery. And then why are you creating them? And then can we fix those? Because many of the people coming in here have other conditions, and it might just simply be old age, varicosities, arthritis, a lot of inflammation, they feel constantly fatigued, they have sleep issues. All of these symptoms are indicative of underlying imbalances that are somehow compromising the environment of your eyes. So Chinese medicine is, you can prove it's effective in circulating blood, so increasing the vasculature of the body. We treat cardiac issues, we do fertility, all of this, that's accepted. And we do nerve conductivity. So when we do all our neurological stroke treatments, we're helping the brain reestablish plasticity. When we do the early onset Alzheimer's, our TBIs, our concussion, our developmental things, that's all neurological. So that's all the nervous system and nerve conductivity. So what's important in these eye conditions is that we are having a positive impact on fixing the body itself and its function to create the most hospitable environment in the eye, which has everything to do with nerve conductivity and blood flow. That's really what's important with any muscle of the body. So if you can effectively influence those aspects of the body, you can influence most conditions. And we do that. So we're M48 certified, we're established herbalists, we train non-stop, we are constantly studying both Western and Eastern approaches to ophthalmological conditions. And I just have to impress upon you the importance that when you have a degenerative condition, whether it be stroke, TBI, concussion, but these eye conditions that are progressively degenerative, start treatment sooner. Once you get your diagnosis, do not wait for more vision loss. It is always harder to get back something that has been stolen or taken or lost as opposed to keeping it when you have it, okay? So we implore you, if you peruse the site, grab the information, start using those lifestyle supplements that are there, start doing these exercises we'll have available, and if it's within your means, your time, your money, come see us, get treated right away, okay? These results are not only proven subjectively by people regaining vision and seeing things clearer, but you can see them on your exams from the ophthalmologist or optometrist. So we typically tell people, hey, we want you to get a baseline. We can perform very basic examinations in our office, like visual exam, visual acuity using a stenels and visual field, but there is no replacement for getting a baseline from your optometrist, like intraocular pressure, visual field, acuity, color contrast, getting an OCT scan, and then being able to do a course of treatment or 2 blocks of treatment and then go back and get that done and see the change. Once you see those changes, it says that you're a responder. Your treatment is not done at that point. What happens is you move into a maintenance program. But once again, all the previous mentioned factors are part in establishing what maintenance looks like, okay? So we encourage you not to wait for the magic stem cell breakthrough. A lot of people have been waiting for a long time for that, or anything else. Start treatment. Preserve your eyesight. We can help you with that. It'd be our pleasure to. It's some of the most rewarding work we do. And if you have any questions, once you gather all the information we have available to us, please go check out our teacher's website, Andy Rosenfarb in New Jersey at AccuVision Therapy. See what's possible. See people's testimonials. And if you have any questions, shoot us an email. We'd love to get back to you. We're here to help people, okay? In the meantime, make well, be blessed. Thank you.